Hello and welcome to the talk titled Privacy Preserving Patient Clustering for Personalized Federated Learning by myself, Ahmed, and my PI, Gamze Gursoy. First off, what is federated learning? It's a distributed learning algorithm that enables multiple sites to train a model without sharing their data, and it relies on having a central server that distributes a global model and local clients that train on their data before passing model weights back to the server that aggregates these model weights. The aggregation is typically done via federated averaging, which just takes a weighted average of model parameters from each site. Federated learning has become popular in healthcare as a way for different sites to collaborate with each other without ever sharing information about their patients. However, one of the drawbacks of federated learning is that performance can degrade when data between sites is non-identically distributed. And unfortunately, these types of distribution shifts are common in healthcare. They may be down to things such as patient composition, differences in treatment guidelines, or even in reporting guidelines between patients. Sites. One way in which people have tried to overcome this is via personalized federated learning, in which the algorithm tries to account for distribution shifts among sites while training. An example of this is clustered federated learning, in which you try to split the datasets into groups that are more identically distributed. And this works well when the datasets already naturally partition into different groups. So for example, if you have different patient cohorts that may have different disease presentation or response to treatment, and you feel that they may benefit from separate model training. However, trying to identify these clusters in federated setting presents a challenge. This is because patient clustering requires the sharing of patient-level information, and doing so between sites would violate the principle of federated learning. Existing approaches have tried to overcome this by sharing average hospital-level data. However, unfortunately, this does lead to clinically less relevant groups and worsen performance. Secure multi-party computation is a cryptographic technique that would allow for the joint calculation of patient-level data that could be used for patient clustering. In our technique, privacy-preserving community-based federated learning, or PCBFL, we use secure multi-party computation to estimate the cosine similarity between patients across sites and cluster based on the similarity matrix. We then enable a downstream prediction task per cluster and compare the performance against other federated learning algorithms. The unique approach for PCBFL is that it enables patient-level embedding clustering. We find that PCBFL produces clinically meaningful clusters and improves predictive performance compared to other federated learning algorithms. So shown here on the left, we find that we are able to distinctly produce 3 severity levels. Finally, we'd like to note that PCBFL also can be used for things outside of prediction tasks, such as phenotyping or even understanding disease progression. I'd like to acknowledge my PI Gamze Gursoy, the rest of the G2 lab, and the NIH for funding this study.